Aloha, everybody, and I'd like to welcome you to our Zoom meet and greet for Gary Cordery, candidate for governor of Hawaii. I want to introduce myself. My name is Matt Martinson. I'm a campaign volunteer and will serve as your moderator for tonight's Zoom. We hold these meet and greets every week, sometimes in general topics, and sometimes like tonight, we'll be addressing specific topics. So if this is your first time, I'd like to welcome you, but please stay on the website and check our events page to see when we have future events coming up. Tonight, we're going to be focusing on the topic of health and wellness. We'll hear from a special guest about the current conditions of our healthcare system, and then hear from Gary Cordery, candidate for governor, about his approach to addressing these issues and to lead us towards better medical care and healthier Hawaii. After Gary's part, he will be opening it up for question and answers. So I'd like to encourage you to have questions ready for Gary, which we will spend about the second half of tonight's time using for question and answers. A few reminders about etiquette. First of all participants will remain muted, and any questions you have should be written in the chat, and then I will ask Gary your questions. Your questions and comments are welcome, but please keep them appropriate and respectful. Anybody using inappropriate language will be removed from the meeting. Also, by joining this call, you'll be automatically enrolled in receiving emails and updates about the campaign. If at any time you'd like to stop those, you may opt out. This meeting is also being recorded. In a few minutes, you'll be hearing from Gary Cordery about the role government plays in the health and wellness of the people. Particularly in the past 2 years, issues regarding access to quality health care have come to the surface, and many shortcomings and discrepancies, and how you view it, maybe corruption, has been exposed. Gary will share with us his vision for improving this system and improving the health of the people of Hawaii. But first, we have a very special guest with us tonight, Dr. Chelsea Ching-Endow, who has offered to share with us tonight a physician's perspective of the current medical landscape in Hawaii and the challenges faced by doctors, nurses, and most importantly, us, the patients, who must navigate a complicated and oftentimes confusing system to access quality medical care. Dr. Endow is a board-certified physician. She's an outstanding doctor of internal medicine and has been in private practice for 15 years in Hawaii. She's married and a mother of 2 children, which she calls her other job, probably the more difficult and important one. And Chelsea was born and raised in Hawaii. She will not be staying on to take questions, so please keep your questions directed to Gary tonight. And so at this time, I introduce to you Dr. Chelsea Ching-Endow. Take it away, Chelsea.
Oh, hi, everyone. Thank you for having me. I really just want to thank Gary, and I thank Matt and Susie so very much. And if Kat's on too, I think she's on. Thank you. They're all splendid. And I'm so very honored and touched to have this opportunity to just chat with everyone. I'm just going to be giving just a real quick introduction as to the state of healthcare in Hawaii. And this is just a segue into what Gary's going to be talking about next, because he has phenomenal ideas. He has solutions. He has just a great vision of what he wants to bring and what he sees to make Hawaii just a beautiful place to live and grow and have your family. There's really just 3 pillars of service that will make us a state and a functioning city. The first is education. The second is protection. And the third is medical. So here we go with the medical side. So the current landscape of the medical sector in the United States is changing. Currently, medical care in the nation is considered to be very unstable. COVID-19 further exposed all the problems that we have in healthcare. And Hawaii is not immune to this systemic problem. We need to remember that majority of the laws that govern healthcare start in Washington, D.C. The medical sector is governed and influenced by a multitude of government agencies. CMS, which is otherwise known as the Center for Medicare and Medicaid Services, FDA, DEA, CDC, anything that has a letter, okay? With this in mind, we need to remember that we have a lot of red tape and rules at the top for healthcare. And that means we need to be very concise and very focused on specific medical issues that we can change here locally at the state level. The entire system of healthcare nationwide needs to be overhauled, but that will take an act of Congress. And unfortunately, the opposite of progress is Congress. So with that being said, Hawaii is a very special place for medical care. I'm not sure if you all know this, but we're the only state that requires employers to provide healthcare insurance to our employees. And then we rely on public programs such as Medicaid, otherwise known as QUEST, to provide coverage to residents who are not insured through the employer mandate. Yet, despite having all this healthcare coverage, we found that Hawaii faces great obstacles in the medical sector. And these are just the top of the list, okay? There's a plethora of issues in healthcare, but these are the top 6. So the first one is, despite having healthcare insurance, many Hawaii residents cannot obtain health services. And the reason for this is access problems, which include a number of providers in certain areas of the state, and a limited willingness on the part of certain private providers to serve Medicaid patients. Providers have a right to choose what kind of insurances they're willing to accept, and Medicaid provides the lowest reimbursement to all. Hawaii reimbursement is lumped in with the Marianas Islands in Guam, and the physicians are not equally distributed throughout the state. With the most recent trend is for physicians to be employed by big hospital organizations. And all providers are stuck with a compounded GE tax burden policy on medical services that also contribute to the ever-increasing doctor shortage. The second item is that we have rising healthcare costs. So Hawaii is not immune to the high cost of healthcare that we're witnessing in the nation. Administrative burdens, high salaries to hire and retain employed physicians, nurses, other staff, and then of course, medical equipment that costs increase due to medical technology advances are outpricing all of us. The third is mental health and drug rehabilitations and services is severely lacking. I think most of us hear that on the news or very well aware of that. Number 4 is in Hawaii, we have one major insurance monopoly, and that of course limits free market options. We also have only 3 really giant medical centers. One is Queens, the second is Hawaii Pacific Health, otherwise known as HPH, and Kaiser, and they're taking over all of Hawaii. Number 5, we have a very aging geriatric population with very limited community resources for them. And many geriatric patients are financially constrained, and that hampers their health care. And lastly, but very much not least, is a very limited outpatient services for all. Majority of the work in medicine is done in the outpatient community sector. That's where we strive as primary care docs to keep you healthy, keep you happy, keep you out of the hospital. And currently our foundation is very shaky. So with this introduction, I hope it sets the tone for what Gary's going to talk about next, which is some of his suggestions, some of his ideas about how we can grow and develop from this. None of these can be solved overnight, but I think if we brainstorm and we collaborate together, we can all find great solutions and can make Hawaii a better, healthier place.
Dr. Endo, thank you so much. That's a sobering description of our current landscape. And yet it's nice to hear you say that there's hope in making this better. If you don't mind me asking just one question, you brought up a shortage of providers. What advice would you give young people who are thinking of getting into healthcare fields to help them understand their role to improve the quality and access to medical services in Hawaii?
Oh, definitely don't give up. If you have a call to serve and you want to do that, especially in healthcare, and truly help people, then you should do it. You should get out there, study hard, pursue your interests, whether it be pharmacy, occupational therapy, doctors, nurses, whatever you want to do. Sky's the limit. I think that's the beauty of medicine in general, is that you can tailor what you want to do. If you want to work outpatient or inpatient, you can tailor that to what your true passion is. And hopefully the young people coming in will realize that the landscape is changing. And probably in the next 5 to 10 years, what I'm talking about here will be different. Maybe it'll be better. Maybe we can have a beacon of light ahead of us, and we can truly be, right, the superpower of the world, the nation that leads in healthcare instead of being close to one of the last in healthcare. And Hawaii can be the shining example for what we want to do to take care of our kapuna and even our young keiki. So, strive for it. Don't give up hope, but just know it's a rocky road right now.
Yeah, thank you. That's great advice, to persevere. And I think, it's what we've been doing the last 2.5 years in all aspects of our life. And no area is as important as, quality medical care. And so thank you for that perspective and that answer. Gary Cordery has spent several months talking to people, including Dr. Endo, to help find solutions to many of the issues in our state. Gary is a Hawaii business owner, a family man, a man of great faith in God, and an honest, humble, and passionate leader. In addition, he is one of the hardest working men I know and wants to do everything he can to bring us a better Hawaii. So at this time, I turn the evening over to the star of the show, Gary Cordery.
Matt, you're always far too kind. What a generous man. Thank you. What a gracious introduction. And what a fabulous start of the evening by Dr. Endo. Before we go into that, I just want to thank everybody who's joined the call and others who will be joining as we discuss this topic this evening. I just want to say it is such an honor to be able to sit with you. I mean, we're not in person. I realize that, that's obvious. But the fact that you would take the time to spend and just discuss and consider such an important topic, I think Dr. Endo has illuminated so many issues. She should be running this entire call, to be honest with you. This is part of the vision that we have as a governmental piece, that is to enroll other experts to speak honestly about what's actually going on in the real world. I think her input demonstrates that the medical health of a state, of a society, of Honolulu and the neighbor islands in general is far more complex than people are aware. And with so many stakeholders with their hand in the cookie jar, it makes it nearly impossible for us to have what we all hope for, and that would be good medical care at a price, and a reasonable price that we could afford. So that being said, Matt, again, thank you. We're going to spend a few minutes talking. Matt, you'll give me a little help on the clock. Well, that's right. Yeah.
Yep.
We'll spend about 15 minutes or so talking about government in general, and then more specifically, we'll take questions regarding healthcare. And I think one of the principles that we've been discussing over the last couple of months, as I've begun to understand the way the government is set up here in Hawaii, set up by the governor himself, has led to what we're experiencing in healthcare, and that is very inefficient, overpriced, unmanaged, unaccountable government in the area of healthcare. Many of you may or may not know, but our governor here in Hawaii is the most powerful governor in the nation. When I tell people this, and many of you have heard this before, but when I tell people this, they really have a hard time envisioning exactly what that means from the perspective of tangible policy. And so when you think about tangible policy and at the governor's disposal, he actually nominates all the deputy directors, all the directors of all the agencies that implement policy into our lives. What this means is essentially he alone controls the nature of the policy and the direction that the state is moving forward in every area of your lives. Now we're focusing on healthcare tonight, and it's no different within the Department of Health. The governor himself actually nominates the director. He nominates the deputy directors. And then there's this process that goes on that the Department of Health establishes a budget, their proposed budget. And I just want to go over this so we have some backdrop for the conversation, that the department itself goes through its processes and decides what it believes is the appropriate budget request for FY23. I mean, we're in 22, so let's just say 23. They develop a budget request based on what they believe the needs are going to be, and whatever that criteria is, they come to some conclusion, a budget number, which is submitted to the governor's office. The governor's office then, within the governor's office, they also are working on a state budget proposal, and at that point, they take the budget request from the Department of Health and they present it to the legislative branch. This process is pretty typical for all of the departments, whether it be the Department of Health, DLNR, Department of Education, all the departments, they run in the same fashion. The departments themselves establish a budget, and ultimately it is submitted to the legislative branch, who at that point, they look at what they believe the revenues are going to be for FY23 and 24 and et cetera, and how much money they think they have to spend. And they'll come to some decision based on the determining factors, estimates made by, various people on what the revenues are going to be. And then they'll actually make the allocation to these departments. So that's how the process actually works. So this actually may sound very complicated. It is not that complicated. But what it does do is it creates a great deal of mismanagement and waste, because you have administrative levels making decisions that really aren't policy related. They're driven by agendas. They're driven by estimates. And one of the things that I found most curious is they never go backwards. The budget request from the previous year, so we're in 22 right now, but the budget requests from 2021, the baseline of the budget for 22 is automatic. Whatever 21 is the baseline. They never actually consider the accountability piece and how they've saved money or where they've made progress and where they can reduce spending. They automatically get 21 and add to it. This kind of a use it or lose it. You don't use all the resources in government accounting. You lose it for the following year, the upcoming year. And this is one of the primary reasons that we never seem to get our budgets under control. Most of our families, most of you folks on this call likely have a budget. You know how much resources you're going to have to pay your bills for that month, and you save and you make adjustments as the month comes to close, and you plan for the next month. Well, the government operates on what you would think would be a similar process, but they do not do that. They actually operate on, we will have the last year's budget and we will make requests for the new year, and then we'll actually amend the budget as needed. And this is essentially where the problem comes with regard to accounting and budgeting and fiscal responsibility. Matt mentioned in his opening, and ultimately much of these resources get lost in the shuffle. And this is always a mystery to the people who pay with their taxes, what happened to the resources that were consumed by the government. Nevertheless, it brings us to where we're at now, and what I hope to do and what we will do, and which creates the greatest level of hope for our state, is the fact that the new governor, as your new governor, I will nominate new directors and new deputy directors, and we will begin to actually implement policies that have accountability, that you will actually know where your resources are being spent. And how you will know that is we will illuminate everything. We will actually illuminate how much of your tax money went into the general fund, how much of that tax money was provided to the various agencies, what was added to it, who added to it, why it was added, so that we can begin to see some sense of responsibility in government. In addition, we will use a biannual budgeting method rather than an annual budgeting. So the desire to just create a large budget based on numerous elements will go away. We'll actually do a 6-month budget so that these various agencies will have to manage their budgets for 6 months at a time, similar to the way you have to manage your budget 30 days at a time. So what this will do is it will actually create some spending responsibility, and people will know where their resources are going. So once the legislative branch allocates this money to these departments, and let's just stick with the Department of Health, because that's our topic for the evening. The Department of Health, through its deputy directors, will have been thinking through and designing and coming to a decision about what aspects of Department of Health's overall responsibility are going to receive how much funds. This is the area where there must be accountability, not just from the overall budget, but each department must account for its spending. This is also the area where we're going to change the nature of the relationship between the citizen and government. Currently, your recourse with the governor is to contact your legislator, hoping that he'll respond to your request, whether it be a request for services or you have some type of a complaint that you'd like to have recourse. Currently, you get no response because the legislators that's not their job. These policy issues, these changes that need to be made with regard to what affects your life actually happens within the departments. So what we're going to do is we're going to create community access into these various departments at the deputy director level. This means if you have, in this case, let's just say we're Department of Health, let's say that you're very concerned about the homelessness condition in your neighborhood, and you wonder why nothing's going on with homelessness, why there's no improvement, why there's more, maybe there's whatever the issue is, you'll be able to come into the Department of Health, the deputy director who actually is in charge of homelessness policy for the state of Hawaii. That's where we'll be able to bring new resources. As an example, we'll begin to bring nonprofits back into the picture. Whether you know this or not, but much of the policies that the departments initiate and implement are policies or regulations. They actually restrain the people from participating in the welfare of the state. So there's many organizations out there, many nonprofits who have a passion to serve the people on the street. Currently, these organizations are restrained by regulation from bad policy within the Department of Health. And so you can see, if you begin to look through the policy decisions, the policy makers within the departments, we'll be able to actually have access for the public to come in there and actually reason together and design policies that make sense, that are fair, they're equitable, they're just, they're responsible, there's accountability to them, and that is, in a sense, how we're going to change the nature of government. We're going to take that same strategy and we're going to take it to every department. The Department of Land and Natural Resources, if you have land issues, if you have zoning issues, if you have land use issues, if you have waterway issues, if you have beach access issues, all of these kinds of things, you don't really think that these are actually, that there's a department, there's a director that's in charge of each one of these types of decisions. You shall have access to your government through the deputy director in the area of your concern. This is going to be a significant and a paradigm shift in the way our government functions. Currently, you have no recourse. I'll bet you that unless you're deeply involved in political activism, you don't know who's in charge of why Mr. Obama got a seawall. Just throw one thing out there, and you can multiply this by 500 things. There are deputy directors who are making decisions about loopholes, making decisions about corruption, both to get things and to lose things. There's decisions about everything in your life. Everything from traffic cameras coming to health policy, passports, vaccines, mask wearing, Department of Education. All of these things are within the departments of that agency which addresses that concern. So you can imagine the shift that's going to happen within our state over the next couple of years. It's not going to be turn the light switch on and everything's going to change. We're going to start implementing policy where there's low-hanging fruit. We're going to identify obvious areas that are easy to correct, easy to understand, and we're going to bring professionals in, just like Dr. Endo, and we'll have them speak and guide and bring policy changes that make sense. That which she started off with tonight, and we'll just move right into this, Matt. That which she started off with tonight with the Department of Health, there were some fundamental things that her and I had discussed previously on the phone earlier this week. And primarily what you have is you have big government, which is the problem for every citizen in the state. We have big government consuming the wealth of people. distributing the wealth of the people into administrative teams who never actually get to implementing policy into our lives. So the resources that are your taxes, they never affect your lives. They just get burned in paychecks. They get burned in debt relief, debt payments. They get burned in pension benefits. They rarely get to where you live. And so as she talked this evening, you heard her say a couple of things that were very important. One, healthcare starts in Washington, D.C. The number of stakeholders and peoples with their hands, I'm going to just call it the cookie jar. The resources of the United States of America, the health of America, nearly 20% of our GDP goes to health now. As a country, we spend more than any other country in the world, yet we have some of the worst healthcare. What does that tell you? It reminds me of everything we recognize in our state, the same problems we have in Department of Health. We spend $15,000 per student, yet year over decade, we have the lowest proficiency tests in the nation. We have the highest homeless population per capita in the nation. We have the highest tax rate on the citizens in the nation. I just told Kim earlier tonight, why does Hawaii have so many distinctions that are not good? Why? Big government. This is why. The bigger the government, the smaller the citizen, the less freedom, the more burdens, the more taxes, the more onerous are the regulations, and it's essentially becoming it's becoming impossible to live here. The fruit of that, the result of that, is our people are leaving. Our kids are leaving. Our businesses are leaving. Our population is shrinking. Our tax base is shrinking. Our industry is left. There are so many things that are sobering. I thought Matt mentioned earlier, very sobering, Dr. Endow's overview of the medical history. But I can tell you, even though these are very sobering, because of the way the state is set up and ran, giving the governor so much authority, this also creates a great opportunity. You should not be in despair unless we elect the same people for the next 4 years. Then there's going to be a lot of despair. I'm just going to tell you. If we don't have a change in the leadership of this state, I do not know how we're going to survive another 4 to 8 years. It's almost inconceivable because of the trajectory of the state government, its ever increasing size, and the crushing weight of that on an ever shrinking population and tax-paying base. So I just say to you, the choice is clear. We must have smaller, responsible government that frees the people up, that they can live free, and government can get out of their way. And how that shows up in healthcare is what we'll discuss for the next few minutes, and then we'll take questions. Some of the things that I noticed that she mentioned, and I know that you heard them as well, the 5 main topics. The one that struck me most importantly was her last comment that said that, a couple of last comments. One was the limited outpatient services that are provided for the people of Hawaii. Recently, our traveling team, as we go from island to island, we sit with people, we talk to them. I sat and had a conversation with a lady in a restaurant in Molokai. She was an elderly lady, a kapuna. She is terrified about getting sick because there's no kapuna care there. There's no services there. And so when she gets sick, she went on to explain to me, if I get sick, I don't know what I'm going to do. I don't have the money to go to Maui. I don't have the time to go through what it takes to get the resources in place to go to Maui, or if it's even more severe, make it to Honolulu. And she's living in a level of anxiety and fear that is causing her health to decline in and of itself. So when Dr. Endo talked about limited outpatient, what she was really referring to is, why is it so limited? Here in Hawaii, we have a crisis. We're about 1,000 doctors short to be able to provide outpatient services for the state of Hawaii. Molokai is a perfect example. They have none. One of the things that we have to do is we have to start creating the ability for doctors to make a reasonable profit. It may, this idea in our minds that doctors are all wealthy and you know, they all drive Porsches and live in Kahala. It is not true. Many of the doctors that serve our community are hardworking people. Yeah, they make a reasonable and a nice living. Of course they do, they work hard. But the idea that the state through regulations has made it more and more difficult for outpatient doctors to actually survive and have a medical practice that thrives is exactly what we're seeing in our state. The doctors who are not a part of a large system are simply leaving. They're leaving our state. And when you think about the idea that they're paying an additional 4.7%, a general excise tax, on all of their services, that equates into huge numbers for them as a physician. Because currently the way that it's been set up, and these are the things that we're going to do as a Department of Health directive, is we will simply remove the general excise tax on their services. Many of you don't know, but these big hospitals, Queens, Kaiser, Hawaii Pacific Services, these are actually nonprofit facilities. They have achieved a nonprofit status, which means they don't pay the same 4.712%. They're exempt. This is policy. This is not an accident. This is state government putting the onus on extra money on these private providers that the big corporate, the big government hospital and associations do not pay. They have nonprofit status, therefore they don't pay this. This amount alone is driving. We had this long conversation. She said these numbers may seem small, but these are the numbers that are the tipping point. These are why these providers are leaving the island. So the consequences of bad policy, a simple excise tax implementation, a regulation, a fee assessed to these doctors is the tipping point. They're leaving the state. So government has a responsibility, good government has a responsibility to create an environment so that healthcare providers, the ones who actually provide these outpatient services, can have a successful practice. And when you think about a doctor being in Hawaii, it's not just the doctor. Think about a doctor's role in our lives. You go to the doctor and you sit there and you listen and you share with him your problems. You're actually, a lot more is going on than the fact that you have a sprained ankle. You're having an opportunity to talk to somebody who listens to you. They're providing, whether you know it or not, they're providing a different service. It's an important aspect of life, communication with another human being. And then they have a staff. They rent an office. They buy medical equipment. They have 3 to 5 to 6 people working there, which is employment. So that doctor and his or her presence in Hawaii, it has a far bigger impact than the fact that they can just provide a service. They actually are providing much more than a service. They're providing for the tax base for a healthy economy. There's a direct relationship within our state between the wealth of our state and the health of our state. If our state is unhealthy because of a lack of wealth, then you must look at why there's a lack of wealth. This is bad policy. So there's many things that can be done. We're going to be addressing these things one by one. And what I appreciated about Dr. Endor's perspective is that she has thoughtful ideas. Why? Because she works in the industry. These are the kind of people that we're going to bring together and we'll develop policies that actually serve them, which in turn will serve you, which will serve all of us. And the other thing that was most shocking to me, there's a number of things that are shocking to me, but the other thing is that we only have one health provider, HMSA. We will never get things under control as long as we have a monopoly in any industry. So why don't other health insurance carriers come to Hawaii? Because of regulations, because of government imposed regulations on what it means to have business in Hawaii. So these large organizations, Pacific Health, HMSA, the Queens Group, these organizations are currently consolidating power by purchasing and buying up other medical facilities around the state. You may not know this, but all the urgent care facilities that are around the state right now, they've all been bought by Queens. Queens has bought Wilson. Queens bought Kaiser West. Now it's called the Queens West. And what you see is the consolidation of power, the consolidation of resources, just like the state government. So one of the things that we're going to do as a government, as your governor, is we're going to decentralize the way the Department of Health functions. The Department of Health covers so much more than just medical things. They cover things like clean water, clean air, mental health, homelessness. There's new waste, Department of Waste. All of these agencies are under the Department of Health. COVID, all things COVID were now put into the Department of Health. I just read through a list of things today. The Department of Health was basically bragging about their accomplishments over the last year. They listed about 25 bullet points of what they accomplished. 22 of them or so were all COVID health mandate related issues. Do you want to know where your resources went rather than to medical help this year? Medical care? To implementing COVID policies directed by the CDC and the FDA. This is not health. This is a protocol. This is why you have doctors being censored. This is why you have protocols being offered at the hospitals rather than care. This is why you have drugs, therapeutics restricted from the marketplace in lieu of getting a quote unquote vaccine. And so these are the kinds of policies that must change. The idea that a few people sit within the Department of Health, the director, and I'm going back to this again, the director and the deputy directors created policies for the state of Hawaii for all things COVID. They made the request for the COVID resources, which they received hundreds of millions of dollars. They distributed to the very organizations that they thought were would be most appropriate. And none of them were directed at the people's well-being. So these are the kinds of changes that we're going to make. We're going to decentralize. We're going to create competition. We're going to make space for health providers like Dr. Endo, which, by the way, currently there's about a 50-50 ratio. 50% of the state's doctors are within a large health organization. Those organizations and the protocols that they use to bring, quote, health care to the citizens are now driven by codes. You no longer get to go in and see your doctor. They'll go in there and they'll give you a code for some prescription or some procedure that is directed by the insurance companies, how much they will pay. This is not healthcare. This is big pharma, big health, and big government, all working together. And the idea is to cut medical costs for the population in general. What's lost? Personalized healthcare designed to make you well. We will actually redirect these ideas and we will begin to emphasize healthy living, exercise, healthy food, grown in Hawaii. What a concept. We actually have food coming from our own ground, our own aina, where you can have fresh fruits, fresh vegetables, dairy, poultry, beef. These are the kinds of healthcare issues that need to be implemented so people and their natural bodies, their natural immune systems can thrive and have the ability to function without government putting medication into our bodies. It must be the top of the tier, not the last resort. Currently, health and wellness issues are an afterthought. They should be promoted from the front on a regular basis. We should have all kinds of policies celebrating healthy activities, family, service. These are the things that we need for a healthy state. So Matt, these are just some of my, I know I'm rambling a bit, and maybe this is not the right format for that, but I want the people to know that there is help, but it must come by the way of change in policy. And this policy will be changed. We will bring together people who understand good policy that meets the needs of the people. No longer shall we be a code-driven, protocol-driven health system designed to move the masses. We will endeavor to put healthcare back between the patient and the doctor, not driven by protocols, standards, payment benefits, those kinds of things. I do not believe they're a part of healthy society. So I'll leave that, Matt, and then I'll leave it back to you to open up as you see.
Okay, thank you, Gary. And I do see some questions coming in to the chat box, and I want to encourage all of you participants to type in your questions, and we'll get to as many as we can. Some of them are sent to everyone, some have been sent privately. Gary, the first question we have is regarding homelessness. You touched on homelessness a little bit earlier on, and as it relates to mental health, what is your approach to tackling the problem of homelessness?
Matt, thank you. That's a great question. I'm not sure who sent it, but thank you for sending that. I mean, homelessness currently is out of control in Hawaii. You know that. You see it everywhere. I mentioned earlier that we have the highest homeless population per capita in the nation, and I've mentioned this previously, that the issue and the way that the Department of Health deals with homelessness is that they treat it as a problem. They don't actually find out who's on the street. It's just a problem. Rather than understanding these are people, that this is humanity, and that these people are really divided into 4 basic groups. And these 4 groups must be addressed individually. They cannot be a broad brush. We're gonna throw money at it, and that's gonna solve the problem, and we're never gonna get involved in people's lives. First of all, one of the main components that I mentioned earlier is we need to allow nonprofits back into the process of helping people who are on the street. It's part of our responsibility as citizens of a state to care for the least among us. A society is known not by its wealth and strength, it's known by it cares for the least among us. So the Department of Health has the responsibility to do this. They have the funding, although, much to my chagrin, during all this COVID money that came into the state, the health department actually reduced the funds to help the homelessness. Currently, the homelessness is comprised of four main groups. There are those who are on the street because of mental illness, as mentioned, Matt, mental illness and drug addiction. This group of people need to be assessed. They need to be assessed by a medical professional. There needs to be facilities open within current government-owned properties. And my recommendation will be we'll use the University of Hawaii Medical Department and create an accredited portion where they can come and they can assess the mental illness, the drug addiction, and we got to get them into a facility that will actually get them off of drugs or help them with their mental illness. We have a brand new facility over here in Kaneohe. We have to make space available to do that. These folks are not going to get better unless they get professional help. Then there's people who are on the street because they've had an accident. Maybe somebody's died in the family. Maybe there was a severe illness. Maybe they lost their job. Maybe there was a divorce. Maybe there's any number of things, and they couldn't make rent, and ultimately they lost their home, and now they find themselves and maybe their family on the street. These folks need an immediate hand up. They need a place to move into. They need a job. They need a bus pass. They need a shower. I've sat and talked with people like this. They don't want to be on the street. A young man asked me, I just want a shower and a bus pass. I can get a job if I can just have a place to shower and a bus pass. This assessment of these people is not that difficult. So we need accurate assessment. Then there are those folks who want to live on the street. They just would rather live on the street. They're currently living off of social services. Our government here in Hawaii through the health department is the most generous state in the nation. There's no restraint, there's no restriction on health services to anybody that's on the street in the state, and the people know that. And so they just live on the street. And I'm simply saying, this may not seem like a loving thing to do, but these social services for people who are able to work must come to an end. There must be a termination date. We give them 60 days, whatever the number is, 45 days, 60 days, 90 days, but at that time, those services come to an end. They no longer can have free services unless they work. They must work. This is a part of, you must work and be a part of a healthy society. Then there's the folks that are here, they've come here, they've got a one-way ticket and they've got a paper in hand where to get services. And there's also this new group of people who are coming here. They're called when it snows on the mainland, what are they, snowbirds? We call them snowbirds. But they come here, they have a one-way ticket. Our Attorney General must take action with the states who are sending these people here with a one-way ticket and a list in hand of where to get social services. This must stop. These folks are coming here. They actually need just to go home. They need a ticket home back to their families. Homelessness must be cured in the family. If they're able and there's family there, that must be where the help is. So in saying all of that, Matt, the question, the underlying principles are we need the nonprofits back involved in helping people. We need assessment, and we need actual tangible help based on their actual needs, not a simple one size fits all program is what we currently have. Responsible, accountable service by people who understand the problem. That's a long answer to a complicated question.
It is, and I'm sure you could go on for hours more because it's a very complicated issue. Here's another issue that we're all very familiar with, has to do with mental stress, which I'm sure we've all felt in increasing measure over the past couple of years. We all know that mental stress can affect our physical well-being. What changes in the first few months will you institute to provide some relief?
I honestly, one of the first things that will happen is people will actually get hope. Everybody on this call knows what this stress feels like. I've laid awake at night. I've wondered how it's going to work out. How am I going to pay the bills? And one of the things that always helps me is to realize that there is help on the way. There's hope for the future. Tangible policies to help people with stress right away. People need to know that there's going to be relief from the overburdens of the taxes and the cost of living. So some of the things that we're going to do right away is we're going to start eliminating things like general excise tax on food, on medicine. We're going to start to lower the cost of living. We'll start to create policy within these departments that actually serve the people. So if you're frustrated, if you're having a problem with government and you're so frustrated that you're ready to leave the islands, this is the kind of access that needs to be made available to the people. I don't know exactly the nature of the reason for people's stress, but I can tell you one of the things that goes on for people, it goes on for me personally, is if I don't have some way to articulate and talk to somebody about what's possible, then I'm stuck. I'm stuck in it. And so we need to create the possibility for people to actually have somebody to listen and to understand what's going on for people, and then they can have an avenue to work forward. Oftentimes, the answer is right around the corner, and nobody has actually said, hey, have you thought about this possibility? Or maybe if you didn't do that, there's this possibility. And in those simple conversations, the opportunity for a way forward is there. And maybe sometimes, hey, it's going to be okay. We'll make it another day. So it's a hard question, Matt, because it's everybody carries their own level of stress. But people need hope, basically. If I know that there's hope, then I'll be okay.
Hope. Great perspective. Gary, this next question comes regarding health insurance companies and competition. Hawaii State Insurance Commissioner is appointed by the DCCA, Department of Commerce and Consumer Affairs. And the insurance commissioner and its team are involved in and affect which insurance companies are allowed to come into the state and how long it takes to approve them. What can you do to help to increase competition in insurance companies? And as Dr. Endo had mentioned earlier, there's a monopoly with one, and how could that affect our healthcare?
Well, I think having competition is always going to be, a bonus, a win for the people, and the opportunity for other companies to come in and provide services. The fact that you have basically a monopoly in Hawaii reflects the fact that there's corruption in our policies. When you think about, and I think it's even from a business perspective, Hawaii is the only state in the nation that requires the employer to prove that the workman comp claim is not so. In every other state, the burden is on the employee to prove that the injury is actually so. So why would I raise that as an example? Because if you're an insurer, you will not come into Hawaii simply because you know that you're going to pay out every time there's a claim. It's an absolute lose-lose scenario. Insurance companies will not come into a market where they know they're going to lose money. So in Hawaii, when the regulations are put on through the DCCA or insurance commissioner, who, by the way, is appointed by the governor It says DCCA, but the DCCA is headed by a deputy director who's appointed by the governor. This is the kind of policy changes that must happen in Hawaii. Why don't we have somebody in the director's department saying, we need competition? I would say this, I will bring directives like this. I want to see a cut in your budget, 5% within 45 days. And I want to see we want to see where it's at. And I would say something like this. By the end of the year, we want to have invitations for other insurance carriers in the Hawaii market. And we'll let them answer the question, why aren't there other carriers in the market? The people of Hawaii need insurance just like every other state. Why we only have one carrier? I can assure you, there are stakeholders putting pressure on legislators to create regulations to keep competition out of the marketplace. This is exactly how Hawaii is run across the board. The state of Hawaii is constrained the opportunity for other businesses to enter the marketplace in almost every area of our industry, from shipping, transportation, airlines, food, Matson, goods and services, insurance, medicine, all of it. Every one of them are infected. That's the right word. I wasn't going to say that, but it is the right word. They're infected by policy and stakeholders who do not want the competition. This is no different than energy. This is no different than medical. This is no different than the airline industry or the shipping industry. All of these industries, including insurance, have tremendous power and stakeholders outside the state that do not want competition. They want sole source providers, and they want federal funds to back it up. And this is exactly what they have. There must be equal justice and equal opportunity across the board. When I say, and I've made this comment at several things, we must have equal justice. This is what I mean. Equal justice shows up in business when it's called fair market accessibility. Without that, you will not have equal justice in the marketplace. It's not just about, are there equal judgments for crimes committed or equal penalties for crime? It's called equal opportunity for business. And we're plagued by that. This is the struggle. I can assure you, this is going to be the fight. And this will be illuminated. We will find out that people will know why we have no equal opportunity. And we will create equal opportunity by changing the directors. If they're unwilling to participate in a change in policy, they're gonna be replaced.
Thank you, Gary. That's very, very clear. There's a comment/question here regarding, as you mentioned, the Department of Health Director being appointed by the governor. No elected public accountability on health policies or regulations.
Nope.
Comment on that.
Comment. Oh boy, the last 2 years have illuminated the power of the director of the health department, Libby Char. The governor put her in place so that these policies could be initiated and then everybody could turn around and blame her for them. Whether it's the Board of Education, the mayor, the governor, the mayors on the various islands, the city council, private business, they all do the same thing. They all said, well, the Department of Health says we need mandates. Department of Health said we need social distancing or masks, or you must get I don't even want to say vaccine. You must get a shot. You must get a vaccination shot. All of these directives came from the Department of Health, once established by the Department of Health, who took their directives from the CDC. While at the same time, they constrained doctors from actually participating in the welfare of the people. They told the hospitals and worked with the hospitals to limit information. So that information that came out to support the people's decision whether they should get a shot or not was not made available. They didn't tell us how much the negative side effects were. They held those numbers. They withheld information about the death rates. They didn't make distinctions about people who died with heart disease. And by the way, they had COVID at the last minute, but they withheld information. They censored information. They censored doctors. They withheld therapeutics, all from the Department of Health. I made this statement before, and I'll tell you again. I am currently working with a law firm right now. We're already looking at what kind of laws can be brought against malfeasance with all things related to COVID. If it turns out that in Hawaii, we have healthcare organizations, directors or deputy directors who knew about malfeasance, which means they knew what was being put out on the public was not true and it had side effects, we will pursue them both civilly and criminally. I've been working this for 2.5 months. And the only way you're going to get responsible government so that these kinds of behaviors, because I can guarantee you there's another wave coming. Will government stand for the people, or will they cave to Big Pharma, to Pacific Health, the Department of Health? It will depend on who's governor, period. The governor must bring order. These kinds of deceptive practices in any industry must be illuminated and stopped. So that's another big answer. So thank you.
Thank you. It's a big question, but great answer. Thank you. This question comes in related to health and how it could actually create bigger issues later on and starting at an early age. What about the Department of Education implementing gender preference education in elementary school without parental input or authorization? This could be creating stress, bullying, and more mental health challenges. What are your comments?
Well, my friend wanted to show me a video last night, taught at King Intermediate School, seventh grade classroom, a video, sex education video, so showing 2 men having sex and 2 women having sex. And then issuing the kids wood penises, teaching the kids how to put condoms on. And we wonder about the consequences. As a society, this kind of behavior is unacceptable. This is deviant behavior. And these behaviors are now being proposed on the youngest among us in school, kindergartners. We already have in place, this last legislative session, they've already funded an administrative piece to the tune of almost $160 million for an entirely new administrative piece so that psychologists and psychiatrists can teach and advise teachers on how to bring social change into our communities through the education process. This through gender re-identification, transgenderism, CRT, woke principles, everything to do with taking away the male and the female in our society. Man, I could, not to mention that the people of Hawaii, the parents of Hawaii, voted and gave the complete authority to the Department of Education to have sole control over the curriculum that are taught to our kids in school. In addition, over the last several years, all education policy has been consolidated into one department in Honolulu. And the parents have no say. So the kinds of policies that must change. The only thing that I can tell you by way of hope is the governor gets to control the budget. So be of good cheer. This policy that's coming down the pipe This perverted dark policy is not going to get funded, period. We will not fund it. We will simply say that is not education. That is not civics. That is not mathematics. That is not technology or English. That is perversion, and we're going to call it what it is. And we're going to put it in front of the people's face. If the parents in our state are not allowed to see or know what's going on in the classroom, if they're willing to teach that to the kids, then we'll teach it to everybody. We'll show everybody. We'll show everybody. And then the parents must choose. You must vote people in. You must vote people in the House of Representatives and the Senate, the legislative chambers of this state. They must reflect the will of the people. You must vote in people, and we will have a constitutional amendment, and we will change this law, and we will put the P back in PTA. We will decentralize education. We will offer voucher program where the money follows the student. No longer will the unions make government policy in the classroom. Teachers must have merit pay. No longer shall they show up to the classroom the same time as the student. This is what they do now. You may not know this. You've heard stories for decades where teachers are at home. I'm sure you do it, Matt. Matt's in education. You're preparing for your workload for the next day. You got your lesson plan together. You're even buying your own school supplies. Thank you. That's not what happens right now. The union now says the parent shall walk into the classroom the same time as the student, and they'll leave the classroom the same time as the student. You can see that big government has now rotted the education system. This must change.
Thank you, Gary. Thank you very much. And I'm sure there are a lot of parents on your side cheering behind the scenes here. There are just a couple more questions. One is that the Department of Health goals are to promote health and well-being and healthy lifestyles. So more time and resources should be put to promote these. Will there be more promotion for naturopathic care, nutritional, herbal medicine, instead of discrimination against these practitioners?
These practitioners in this wellness program should be at the top of the tier. This should be the first thing that we do as a society. We should promote well living, exercise, good eating habits, good sleeping habits. And they should be promoted all the time. They should be promoted in the public square. Why do we put COVID numbers on the freeway? Why don't we put things like, hey, did you take time to sleep today? I mean, just simple stuff. Promote healthy living. This is what we must do. And this has to start at the top. This is why I'm saying we must change the head of government. The governor has the ability to bring to the forefront what's on the mind of the people. These policies in the Department of Health, they're set by people who are not paying attention. They're career employees, and this is my experience at this point. They're not paying attention to the needs of the people. Therefore, when the deputy directors set policy and fund policy, I don't know how much they actually think about, well, what does this actually happen in the lives of the people? They do what they did the year before, or 4 years, or 8 years, or 10 years before that, and they just keep adding more money to it. And does it work? No, it doesn't work. Even you recently saw this big thing with Red Hill and the water in Red Hill, and the government and the Department of Health was patting itself on the back on what a great job it has done to identify this problem, and they're really working hard with the Navy to resolve this problem. But only in 2016, the same Department of Health gave Red Hill water supply a clean bill of health, stating they were doing a great job in managing the water supply. Only 4 years later, they're screaming that this is out of control problem. This just represents that the right hand does not know what the left hand is doing. Even when thinking about watershed issues, the idea that we're going to manage the watershed of our forests. Do you know what these watershed people actually do? They count pigs. They count wild pigs. These are people with PhDs understanding how the watershed, what happens to the abundance of our waters, what happens to it. They spend their time counting pigs. And I know this for a fact. So this is policy run amok. I don't know how else to say it.
Well, thank you, Gary.
I'm sorry.
No, I really appreciate it. Let's see. I think we don't have any more questions. We've got some great comments, a lot of support for your position on various topics. We have covered a lot, and we were a little concerned about focusing on one topic, but this deep dive has really given us a clearer idea of the issues and some of the possible solutions to that. So we thank you for that. I want to just let everybody know as we start to close tonight that you can please visit our website at www.garycordery4governor.com. If you click on the events link, you'll see that we've got some upcoming events that are a little different than Zoom calls or meet and greets. That'll give you other opportunities to see Gary, and in some of these events, actually Gary up with other candidates, and can listen to them all, share their perspectives on various topics. Coming up on Saturday is Audit the Vote candidate debate with Seth Keschel as the moderator. That's this Saturday at Oahu Veterans Center. It's from 9 to 12. There's a $10 entrance fee. And if you go to the website, you can get your tickets right there on the website. On June 18th, there's another candidate forum. Again, I believe this is Republican candidates, but hopefully we can get some Democrats there as well, at First Baptist Church of Nanakuli. This is in the evening from 5 to 7 p.m. And it looks like that one is free. There's a fundraiser coming up on June 25th. It's called Kanikapila with Gary Cordery. I'm not sure, Gary, if you're going to be bringing your ukulele, but somebody will be there to Kanikapila. This is out in Waianae from 5:30 to 8 p.m. It's casual. Bring your chair and towel. There's a $25 entrance fee, and it's going to be a fun family time. Looks like children under 10 are free. So I'd like to, encourage you to continue to support Gary by attending these events, by coming back to our Zoom meetings. We will have another one on Monday evening at the same time, which will be a more general meet and greet topic. And of course, when you get to the website, you will also see an opportunity to give a donation. Campaigning is not easy, and it is not without great cost. And you probably understand what we're up against with some of the other names, both on the Republican side in the primary. And by the way, that's the first hurdle, is to get past the primary. So don't start looking ahead to the general until we get there first. But, we need to raise funds to help Gary to do all these things. And again, it's not just putting in some money into a coffer, it's actually investing in a vision, in the values that you've heard tonight, and into making this a greater place, not just for us now, but for our futures. So if I could, put out this last request, please, go to the website tonight and make a donation. I also want to introduce to you somebody who is very instrumental in the campaign. Sheila Medeiros is Gary's campaign manager, and I'd like to turn it over to her to have a few words before we close tonight.
Thank
Sheila.
you, Matt. Thank you again for always being a phenomenal moderator. I appreciate your efforts. And thank you, Gary, for doing this deep dive in health and wellness. I appreciate I learned a lot from this discussion that you were able to provide for us, as well as Dr. Chelsea. And I look forward to more of these opportunities. We'll have this once a week. We'll have focused topics once a week, meet and greet Zooms. And we'll also have the normal meet and greet Zooms. So it's twice a week. We'll be doing this mass Zoom meet and greet. So stay tuned, check out the website. We'll be sending out flyers for all of you to participate. And if you have an idea that you would like Gary to touch on as far as a deep dive, then send your suggestions in the chat box and we'll take a look at it. And maybe that will be the next discussion. But I'm here today because what we discussed it is near and dear to everyone's heart: health and wellness, the health insurance issues, mental health issues. I mean, everyone here on this Zoom is touched by one of those aspects. And it's a call to action. Either we sit by and sit back and allow another 4 to 8 years of a democratic controlled government that will continue to, do these just moral decay issues and continue it in our education system and the healthcare system. So we need your help. Bottom line, we need your help. We cannot do this race alone. I'm calling all of you, asking for your help to run alongside with us to get to the primaries. Primaries is only 8 weeks away, 56 days. 56 days. I'm saying that again because it's really quick and we need a lot of support with our ground operations, our phone-to-phone banking, our door-to-door knocking, and our direct mail. Matt touched on the direct mail. We have a direct mail-a-thon that's right now on our website. And that's one of 3 things that we need to do in order to get his message out. And that's direct mail that we are strategically sending to Republican voters. And that's about 22,000 mailers. So what does that look like in terms of monetary? So 22,000 mailers twice before the primary will cost us $18,480. So that's what we're trying, that's the target. If each person can give up to $6,000, that translates to 2,520 mailers. If you can't give that much, $50 translates into 119 mailers. And $10 translates into 23. So every dollar counts. Everything counts that will help us get Gary's message out. We are up against a name, not substance, but a name that we really need to get his name out there. So we need your help. We can't do it alone. The ways you can help us is by volunteering. You can go onto our website and volunteer there or donate. You can also get on your social media platforms, sign up on his IG, his Facebook, his YouTube, his Telegram. All we ask is if you share it and then post a little comment, it'll boost his post up in the algorithms. And share. If that's all you can do is share, that helps us tremendously. And then also invite people to these meet and greets so they can hear Gary. A lot of people cannot, get to a meet and greet physically, but we have right now on this Zoom call, people from the neighbor islands. So we're reaching people just through this platform. And again, we just need your help. We cannot run this race by ourselves. So we just ask if you understand the sense of urgency of getting involved, we just welcome all of you. Again, thank you so much. Thank you, Matt. Thank you, Gary. And we look forward to seeing you folks all in our volunteer training sessions. Aloha.
Thank you, Sheila. And finally, Gary, some just a closing comment before we say goodnight to people. And thank you for joining us.
Thank you, Matt. Thank you, Sheila. I just want to thank all of you for being on the call. You know, as you can tell, some of these issues are complex, and some of the answers, you must know that underneath these answers, there's basic principles. It's the principles of honor, integrity, respect, and these are the kinds of principles that will govern the decisions that we make as governor and how we'll govern as a governing body for the people of Hawaii. These will bring real change and hope for the people, and we will all prosper because of it. I'm just going to share, the scripture clearly says that when righteous leadership is in place, the people will prosper. And when unrighteous leadership is in place, the people will groan. Well, I don't know about you, but the people of Hawaii are groaning. I don't know. If we could have a raise of hands, I'm sure there would be a majority of people who understand what it means to groan and to live in this state. This should not be so. So I just want to thank you. Be hopeful, be of good cheer. We have this unique opportunity to change the direction of this state for generations. Run with us, run with me. We will run together and we will change the very nature of this state. So thank you so much for the great evening. I look forward to seeing you either in person or on another one of these. Invite your friends, like Sheila mentioned. Invite your friends. Hey, listen, go check this thing out. It's pretty crazy. Have a great night. Aloha.
Aloha.
Aloha.